called a meeting to order of the Vigo County Board of Health. Could we start with the Pledge of Allegiance, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call on this.
Dr. Turner, Jeff DePass, Dr. Lim, Dr. Caddick,
Present.
Dr. Ross, Dr. Todd,
Here.
and James McKenna.
Present.
Now for the minutes of the last board meeting of April 20th, which is an action item. Any additions or corrections? Do I have a motion to approve the minutes submitted? Second.
I'll second.
All those in favor?
Aye.
Minutes are approved. The financial report, Wanda?
Do you have any questions regarding that?
Well, we had a discussion in our last meeting. COVID funding. So that we would be part of that discussion. Seems good, the money came because of COVID. Any update on that?
Are you talking about like the Ready Grant? No.
We talked about it last week.
Does anyone recall?
Commissioners were in charge of it.
No.
Not the reimbursement fund, though.
You may have to speak up so that she can also hear you and those out there. You may need to pull it closer. So, thank you.
Any questions on that? Thank you, Wanda. Commissioners report, Dr. Wilkin?
It's nice to see everybody. It feels like it's been forever, so. Don't have anything really specific. Obviously, COVID numbers continue to wax and wane. Hospitalizations, thankfully, are staying down here locally for the most part. We're seeing a lot of COVID-adjacent hospitalizations, and what I mean by that are older folks that are falling ill, testing positive, but are not really there with what we call pulmonary parenchymal disease, which is what we saw early on. We're seeing a lot of just dehydration, weakness, fatigue, falls, those types of things. And it's just a reminder that, you know, even though the virility of this has seemingly been reduced, we still have people that are very vulnerable to the illness itself. And we are seeing falls and fractures and dehydration and kidney failure and things. So it's the onus is still out there to get our older folks in particular boosted, fully boosted, and ready for the next wave, which apparently is on the cusp again. So, but positive test results going up. Monkeypox obviously made a little splash, but we dealt with monkeypox before, didn't we?
Yep.
And it was no big deal. So we're not worried about monkeypox around here. So we ain't scared of no monkeypox. You know, again, our COVID response has remained steadfast. We've been doing exceptionally well. We were able to pare down things, obviously, over the last several months, still staying efficient with it. You know, tests are available everywhere. The treatments are out there. The Paxlovid is out there. Everything is out there now for people. So just another call. Just if you know folks that aren't vaccinated and aren't boosted, still plenty of time to get that done. So outside of that, the Chris Box, Dr. Box at the state level is extremely happy with District 7, with our response. The state of Indiana extremely proud. She and Governor Holcomb as well said they feel like Indiana was one of the prime responders for COVID, looking back at it now. So we have a lot to be proud of there. And so thank you.
I've seen some travel as a goes back to also, like, so many people are coming back and forth. I don't know if Jim being the director of respiratory therapy, in the ICU or respiratory world.
Yeah, we still have some hospital admissions, and we're still treating people with high flow oxygen as needed. But as Dr. Brucken said, it's a lot of it's a secondary to other disease processes sometimes, and when you're decompensated from other chronic diseases, viral type things can put you in the hospital, and so we're seeing a little bit of that. The ICU, of course, is not what it was as far as having COVID admissions on ventilators and high flow and all that, but it's just good to know that we have a lot of things in place now that we didn't have back then, and we know kind of how to treat it. So I think we're very prepared at the local level. I know for if the symptoms will get worse, and so that's something you can rest safely on, is that we've got trained healthcare providers to take care of those symptoms if they get worse.
I don't think we did see, enough blood clots, among the lines of
No,
renal failure, on dialysis.
clinically still haven't seen, we talked about the cytokine storm and things early on, this massive overrush of this immunologic cascade that we could not control, we couldn't stop. And Jamie, please add in here too if you feel I'm misspeaking at all, but we're not seeing that. But that post-immunologic cascade, post-cytokine storm is when all of those clots were coming, all the coronary thrombosis, all of those strokes, all of those things were happening. And now, whether it's the advent or the push to use steroids more liberally up front, the virility of the virus itself falling off as it has variated itself to become more infectious but less viral. Don't know, but we'd rather be lucky than good any day when it comes to that. So, and that's everyone's seeing the same thing. The hospitals, even in the East Coast, it's the same deal. We're just taking it as it comes, but so far so good.
The main problem is the variants. It's not the same as before. The Omicron BA.5 variants nowadays. I came from Las Vegas and I got COVID 2 weeks ago. Didn't expect that. That's why I'm wearing the mask. I tested negative already, so you're safe. But people don't wear masks anymore, so you don't know if you get it from the airplane, because the airplane they don't. And yes, I'm glad I went through the experience. I don't like to have it, but it's less, infectious as before, that you have to be hospitalized, because of your vaccination. So, but still, got a lot of people have no vaccination, and the IV infusion that they give is not the same as like before. It's good for the new Omicron variant. I think it's Beptel, Obimab. It's different. And then Paxlovid is easy to get. If you want to go to travel somewhere that you're not sure, you can always get some doses with you, and plus bring with you some tests, the Binax test, so you can really change the trajectory of your symptoms. Mine is mostly respiratory, really. Trying to get all the symptoms to see, but it's mostly dry cough. I didn't expect to go through it, but I did.
Glad you did well with it, Dr.
I'm mostly a hallucination, I'm a hallucination that I win $1 million. Just joking.
We might need to talk later.
Anything else for Dr. Bruckner? Go on to administrator's report, John.
Sure. We've had a lot of changes at the health department over the last 6 months, and that includes staff turnover. The staff turnover isn't unique for Vigo County. It's a trend in public health workforces across the United States. It was rough on them. The pandemic was rough on employees, and we were overstretched and tired. But with the turnover in staff, it gave us an opportunity to look at how we could work better, how we could work more efficiently, instead of the same old status quo. Cross-training, accountability, efficiency, that's been the main focus on our changes that we've been applying. Cross-training is occurring in all the different divisions of the health department. As you'll hear from Loretta and Mandy and Linda, their staff are in the process of cross-training. Staff working in silos is no longer acceptable. The clinic now has a director of nursing, and she's updating policies and procedures to improve the efficiency of the clinic and the staff. She's ready to reestablish and strengthen our collaborative ties in the community. Our environmental health division is killing it. I don't know if you've even noticed any of the food establishment inspections in the newspaper, just how many they're knocking down. It blows me away when I looked on Channel 10's website one day and saw how many, and then it started resonating. I looked back at others, but just in the last 2 months, what they've accomplished. And, Loretta's staff in vitals, they're almost cross-trained in all areas. Every day she comes to work to create a really harmonious, positive environment, and it allows her staff to be their best. And vector control, well, they're always good. They've always been a well-oiled machine. But letting our staff, perform is a priority, given them the freedom, but with clear principles. We reconfigured the office. We're getting a new service window to do business instead of people coming into the office. But just a lot of good changes. We were able to buy 5 new vehicles this year, 1 out of our general health fund and the other 4 from our reimbursement that we received from giving the COVID vaccine through Health and Human Services. And that's been really good. Got a great working relationship with the council and with the commissioners, and just it's nice to start thinking proactively versus reactively, and just good things to come.
Any questions? Carla, that whole business you want to do?
New business is next. No, you guys have an action item. It's the budgets. You can either vote on them separately or you can do them all together.
Proposal to vote on the proposed 2020.
Should say 2023, that's my mistake, I'm sorry. There weren't any significant changes. Didn't have to meet with the council or the budget committee and go over anything. Mike had originally asked for a couple of new trucks. He proposed a couple of new trucks, but we were able to get them out of the reimbursement fund for this year. So there just really wasn't any big asks this year.
Do I hear a motion to approve the budget?
So moved.
Second. Been moved and seconded. All those in favor?
Aye.
Opposed? So the budget passes.
Oh, she gave a thumbs up.
Yep.
Thanks.
Sure that you know. Then the general health fund.
We're going to go. Did you vote for them as a group or did you do them individually?
As a group.
That's what I thought.
Yeah.
All right, so then we'll move on to Mandy, update the local ordinances and fees.
Lou?
So I mentioned in the last meeting that we were going to start looking over our local ordinances for food, septic, tattoos, swimming pools. I've done a little bit of research. Still want to make some major changes. The septic ordinance is gonna need a major overhaul because we're getting a new code that's getting ready to come out. Last time it was updated was in '91. So, Rhonda said she can email the ordinances to all of you if you guys would want to form a committee with me. We can talk it over, go over fees, that kind of stuff, to see about upcoming changes to those ordinances. So if you want to participate, let me know.
I'd be happy to.
Yeah, I'd be happy
Okay.
also to help you.
Okay. Yeah.
These are the state ordinances coming down.
They're the county ordinances, so those kind of reflect what state code, our state code that we go by.
For example, state code says that they have to inspect licensed food establishments once a year. Our local ordinance says twice a year. So we can make it greater than, but not less than.
Gotcha.
And I know that, like Rhonda said, the septic ordinance, that one's gonna be a major task, because it really needs updated. So, all right.
Amanda, do you have a timeline to bring that back as an action item after it's been, is it the next business meeting or this?
I would like to shoot for the next business meeting, but it might be the January meeting, because it's gonna be a lot.
Okay.
Or at least do septic and then work on the other two. Because the septic one's gonna be a big one, so.
Do you have the ability to pull any comparable city sizes throughout Indiana that we could compare to?
Mhm.
Okay, great,
Oh, I can send those to you.
perfect.
All right.
Thank you.
We're on old business.
Or the strategic plan.
On the strategic plan, we're ready now to rock and roll. So I know that Jennifer said that she'd like to help, Dr. Todd would like to help, Dr. Caddick and Jim. So expect to get we'll get some dates and times going next month.
Great.
We did have Dr. Anthony Ton with us in the spring semester, and he had just finished medical school and needed to do his practicum for his master's in public health. He's now doing his residency in California. But he worked on part of the strategic plan with Emily Milton when she was our community health intern. So we do have some framework to start off with.
There's the program updates. Vector control, Mike.
Good afternoon. Well, before school let out, we distributed about 5,600 Skeeter Beater coloring books, like we do every year. Kids enjoy those, and it's got good information in them. We started our light trap program, started our larviciding program. It's going strong. Our adulticiding program's going strong. Joni gave me some help this year with two young men. Liam and Jason did an excellent job. They helped treat our catch basins, which are over 1,800 catch basins. And they allowed us to go ahead and do our larviciding while they treated all the catch basins. A lot of help. They also worked running the alleys, picking up tars. We're still doing that. We're working on our 6th semi-trailer. We're still taking tars in. So far, we do not have any West Nile positive pools. The state of Indiana does have 2 West Nile positive pools, one in Hancock County and one in Steuben County. And then we have 1 positive human case in Lake County. Other than that, the state's pretty clean right now. With the drought conditions, though, I look for that to change. We were talking about it outside there. I tell Joni all the time, we need rain, we need rain. We need more rain to flush out these dirty, stagnant areas. But right now, everything that we're sending in are Culex pipiens and Culex restrooms, which are both West Nile virus mosquitoes. So it's important that we get some more rain. But we're doing our job. We're out there every day. So anybody have any questions?
Thank you.
Mike, I was kind of curious, when you talk to farmers, how much chemicals have gone up, herbicides, pesticides, and all that?
Yes, it's affected ours as well. We had to ask the council, Joni, last year or the year before for additional appropriation because the price of chemicals has increased.
Price of chemicals and the chemical that we had been using then came out with on its fact sheet that it wasn't as safe for humans.
Yeah.
And so we wanted to go with one that was human friendly.
Yeah, and
It's a
both of
little
them
more
that we
costly.
use now break down very quick in the environment. They don't last in the environment. They're about 2 hours after we put them out there. So we always try to use the safest chemical we can. But it affected the price. Now I look for it to continue to increase every year. Yeah.
Yeah. Mike, could you, since we're nice enough to have some media coverage tonight, would you just touch on how stagnant water sitting around in your yards and things breed mosquitoes?
Sure. I mean, it can be anything from a bird bath to a camper shell. Children's toys are one of the favorite things that we see when we go out on a complaint. Little kids' wading pools, These are items that are in people's backyard, the public's backyard, that hold water, and you don't think about it. And if you let that water stay in there for 10 days, it's going to breed mosquitoes. And it never fails. Every time we get a complaint, that's normally what we run into. It's either tires in somebody's backyard, or it's at children's toys, swimming pool. That's kind of what we're looking at more than anything, and that's where you get your West Nile or your container breeders. It's not the flooded out area to the west or anything of that nature. Is that kind of what you was looking for, Dr. Bruckner?
Absolutely, yeah, thank you.
Okay, thank you.
Thank you.
Thanks, Mike.
Texas Nursing Division. Becker?
Hello.
Hello?
Nice to see all of you again. I was here in a position before under the COVID grant. Now I'm here in a different position, and I'm excited about this position. So first, I just want to ask, does anybody have any questions on what you were given from the nursing position? And then I just want to touch on a couple of things.
COVID-19 total basically administered.
Yes,
Like this quarter, something like that.
that's this quarter. Yes. Yes. Yes, we are kicking it as we were today. We had the waiting room full all day and people standing, waiting for seats, and long-term care facility even brought a bus, and they were on the bus for a while, and yeah, so, yeah.
So what vaccine do we have here?
We have the Moderna for 18 and older, and then we have the Pfizer for 18 and older, and then we have the Pfizer Peds, 5 to 12, and now we just started carrying what we're calling the Pfizer Baby, and it's 6 months to right at 5 years.
You've been able to get all of those.
Yes, yeah. And I think we're one of the only ones, I may be speaking out of turn, but I had a parent come in last week and said that she was from Evansville, and she had tried to get the Pfizer Baby, that's 6 months to 5 years, and we were the closest to her to be able to get that Pfizer Baby. No one else was carrying it so far. I just want to touch on a couple of things while we're there. There was a new rule put out through the state where lead levels now, if they, it used to be the 10 or greater than that, and now it's 3.5. So we're seeing a lot of new cases for the lead, and we work with Mandy and the environmental side of that, but we're cleaning up the cases that we had, but we're getting more cases in just because of that change. Okay? Let's see. We've done certification since we've got new employees there through the state. So we've all completed our TB certification now to be able to do that. State is coming next week just to talk to us about cleaning up some of our policies and procedures, which I've already started on. And then the next week, the person from state is coming to do the lead and get us involved with that so that we understand everything that goes on with that. There is a Zoom meeting this Friday for any healthcare official through the state on monkeypox from 12 to 1. So we're going to be a part of that. And let me see what else I was going to say. The state did visit us on May 31st. And I know I just put, we passed, but that's a big thing for us to be able to pass. That takes a lot of work involved, and that takes everybody in the clinic to be involved in that passing status there, from looking at records to looking at payments to even, we have to put the temperature on the refrigerators and the freezers of the morning and of the evening. And so it takes a lot of work. It's just not coming in and counting vaccines and saying, oh, you look like you're doing everything okay. So I was happy about that. We're going to start working again with Head Start and Early Head Start to do the lead testing again with them. So I'm getting some community involvement back again as programming. We're also going to have students coming from St. Mary and from ISU so that they can work in community health with us in the clinic. We're also going to start the occupational vaccines for Hep A, Hep B, and get a baseline TB on the new hires where it is appropriate for them. So I think that's about it, all we had. I was just going to recap so far this week the cases that have come in for COVID. On Monday, it was 108. On Tuesday, it was 91. And then today, it's 19. So, yeah, it really waxes and wanes as we see it during the week. But I just thought that was interesting, those numbers. Yeah. So I'm excited to be on board. Feel free to call me, email me, get in touch with me at any point in time. I'd be happy to talk with any of you.
The clinic
Thanks.
did have an intern it still has
Yes.
an intern this summer, and it's Tammy Adiagbo. And you might have remembered her coming in with her father. He's a pathologist at Regional, and Tammy attends Johns Hopkins. So we've had a great time with her this summer, just sharp, fresh,
Yeah.
fun.
Fun, fresh, has made flyers for us, it's made things for the clinic for us. She sat in on the TB testing and actually got certified, so she's excited now to go back to Johns Hopkins because she's going to have that. And she's also going to sit in on the lead certification. So she can't wait to go back because she feels like she's going to be a step ahead of all of her counterparts back there at college. And she was going to be here tonight, but she doesn't feel well right now. She's COVID negative, but she just doesn't feel well. So you'll be seeing some of those flyers out and around the community because Michael is the new health educator, and I are going to go out and meet some of our community partners here and get back in touch with them and get those flyers out so that we can work on the vaccine rate for school-age children and get that back up since COVID.
Linda, do you give the Paxlovid and the Molnupiravir here? I thought the Paxlovid pills for COVID
Uh-huh.
are not, they are going to distribute it to non-pharmacy. Are we allowed to give it out from here? Are you giving it out from here? Do you have pills here?
We do not have pills here, but that's something that Dr. Brecken and I can address or talk about.
Right now,
Absolutely.
Dr. Lim, they're being routed through the hospital systems first. The hospital pharmacies are kind of in charge of delving them out from there.
Yeah, I thought they're getting more liberal instead of prescribing that the non-physicians can give it out.
Mhm.
Okay.
About the six Pertussis case, was that one small group, like community daycare? There was something about that.
Yes, it was one small group. And we haven't seen any more. Yeah, it was one small cluster. Yeah. Yeah, thank you.
Congratulations on your being certified.
Thank you.
Vital statistics, please.
Hello.
So the last meeting, I was asked to maybe put in some COVID dates and numbers, and I put that in here this time. And as you can see, we've only had 6 COVID deaths in the quarter. And then we did have that one flu, and that's the same one that I talked about at our last meeting, but it actually applies to this quarter. So it's still the same one. Definitely a lot less than there had been prior. And then all the numbers are on our report. Is there any questions?
Thanks for pulling that data for us.
Hey, no
Appreciate
problem.
it.
If it was at the beginning, I'd probably been pulling my hair out because there was a lot. But no, it's no problem.
Thank you.
I think the numbers are still about 300 deaths per day
Nationwide,
not forgetting this.
right.
start off with my quarterly report. If you have any questions over it, see, we've been extremely busy. As Joni mentioned, my staff is kicking butt right now.
They are.
On top of being trained in the different areas, they're really cranking out those inspections. So let me get to that. I have 3 new inspectors, and I'm gonna have them stand up. So Cheryl Lehman, her primary duties right now are septic, and then she just became lead certified, so she'll be a lead risk assessor. Shelley Rubinacci. Shelley's primary duty is food right now, but she will eventually be cross-trained in pool, tattoos, and lead, and then eventually we'll go into septic. A lot of material to cover. And then we have Emily, who was our intern. She decided to cross over into environmental, and she's primarily food and will be doing the same as Shelley. So,
Excellent.
yeah.
Yeah, and then we have Amanda.
Amanda had already started. I think they met her at the last meeting. She also became lead certified because of the new rule. We're gonna need more inspectors. So when a child's lead level is at 5 is when we have to go out, where before it was 10. So we're gonna see a big increase in cases where we're gonna have to go out and do home evaluations. So that'll be helpful. And like I said, I'd like to get Emily and Shelley trained, so we'll have it covered all over. That's about all I have.
And with this volume, do you have enough staff?
We haven't seen quite the increase yet. We have 1 new case coming on when, in a couple weeks, we'll have to go out and do it, and it hasn't hit NBS yet. I'm seeing it more so on the clinic side, where they're gonna have to do a lot more education and help me out, Linda, the stuff that you guys do, case management.
Yeah, we're gonna do more assessment. We're gonna do more assessment. So, I didn't live in LA. Nurse, so we still have 1 nursing position. That needs to be filled. We carry on with that. Myself, Chelsea, Phillips.
So yeah, right now, on the case management side, definitely, takes 2 capillaries for it to be confirmed a lead case, home evaluation. So if it's a 5 with the 2 capillaries, it have to be a 5 or above for it to be confirmed, or a venous, that's 5 or above, for us to go out, for the environmentalists to go out. But, so, yeah.
What are your other inspections? You have enough? So, what we're seeing every week in the papers is
Yeah, we're doing good. It's good. I'm gonna be positive. It's very great. It's a good thing, good feeling. We have positive energy. We have people that wanna be there and they wanna learn.
That's good.
And they're excited about their jobs.
Good.
That's great. Makes a big difference. And I didn't get to speak. Dr. Turner got to go along on an inspection with me not too long ago.
I would highly recommend anybody that wants to, I'm not really be my friend. I would say be my friend if you ever come to my house. But I was very impressed by what you did in that, the inspections, but I'd like to do some more, sort of get some tattoo inspection.
Definitely, anytime. Anybody's welcome, anytime.
People don't think about public health until something goes wrong. Don't realize what I want to do every day, behind the scenes, but I got a good feel for it, with you, and what you've done for so long. You need to be a professor.
We need her to work with us.
You guys got the right person. You're gonna learn what.
Yeah, they got to go back with me the next day after you were there
Okay,
and got to do the follow-up, so, yeah.
so, but I really appreciate that.
Yeah, like I said, anytime, anybody's welcome at any time. That's all I have. Any questions?
Yeah.
Do you feel like we have, I noticed on the restaurant inspections, it seems like almost more restaurants have violations than are fine. Is that normal, or do you think, like, sanitation has slipped with COVID and we're catching that now?
I think it's the lack of staffing
Okay.
and the turnover. They're doing good just to survive.
Right.
and trying to keep up on things in the restaurant. I think that's playing a big factor into it.
That makes sense.
It's a good observation.
Yeah.
Yeah.
Manny, I have a quick question about the lead levels. Did the state happen to send out any prospectus by changing the values to say, hey, if we decrease to 5 to send people out, we're gonna capture another 10% of actual cases, or is it we're gonna now be inclusive of 70%? They happen to give any type of prospectus on it?
I haven't seen anything. I don't know, Linda, have you?
I just wonder by changing it from, you know, arbitrarily, I mean, it's a very low number, obviously, to go down to, and obviously it draws attention to lead-based paints and lead-containing toys and all those types of things, but just hopefully that there's some science behind that. They did not change, from my understanding, they did not change any of the treatment protocols,
No.
as far as when to treat a kid type of thing,
Just
with
the
chelation
case
therapy, so I just wonder if it's, you know, obviously worthwhile. There has to be some smart people behind it, but I didn't know if we're gonna capture a few or capture a bunch. So, I don't know.
Wish I had an answer.
I'll look too, so I don't
Yeah.
know. Thank you.
Health education and media, Mike?
Hi, guys.
Hey, Mike.
All right, so I started on July 5th, so that was 15 days ago. I am the new health educator and media coordinator for the health department. I am actually still working for Jimmy at Union Hospital as a PRN at the fitness center right now, so 2 supervisors right here of mine sitting right across from me. It's been great so far. My first week was a lot of just learning the ropes, getting organized. Second week, I got hit with 4 interviews about COVID, so I learned a lot about COVID really fast. 3 of those interviews were with news stations. 1 was with the Tribune Star, so I got to get good experience already with interviews. So I really like it so far. This week is my 3rd week, so basically what I'm trying to do more than anything is just reach out to more organizations and make more connections. I'm going, as Linda said earlier, we're going tomorrow around the town putting up flyers. So we'll be able to meet more people, make more connections there. If there's anything I can do that you guys believe you would like to see from me, just let me know. But besides that, that's really all I have so far, 15 days, and future's looking bright. That's all I have to say.
Michael just finished his master's in exercise science, and you have a minor in nutrition?
Yeah.
Yes. So hoping to, which is greatly needed in Vigo County, so.
In your health education, are you gonna use Instagram, Facebook, all the tools, TikTok?
Oh yeah, all those social media accounts will be getting the word out.
What kind of plans do you have, Michael, for the health department? Like, you coming in with your educational background, and I know your work history, you worked a lot of different places and a lot of really cool places. What's your plans, like, going forward for your role at the health department as far as the media goes?
Yeah, so I do have a big background in fitness with my master's degree and bachelor's degree, both exercise related. So I do want to try to implement more fitness-minded programs, but I'm also willing to branch out into other realms of health. I'd like to learn more on those as well. Again, I had the minor in nutrition. I do know quite a bit about that before I even started that, so I would like to go more fitness route, but at the same time branch out to other areas such as nutrition. And obviously with COVID happening, I want to do things relevant to what is currently happening, so learning more about that as well going forward.
Thank you.
Yeah.
Welcome aboard.
Anything else, guys?
See you, we're all good.
All right.
Appreciate it.
Thank you, Michael.
Is there any citizens input this evening? Anybody on that board have any questions, comments, or anything? Good? Is there a motion for adjournment?
Second.
All those in favor?
Aye.
Aye.
Opposed? Meeting is adjourned. Next meeting, October 19th.
Thank you, everybody.
Thanks, everybody.
Thank you.
too. I'm glad you're feeling better.